Hi, in this video, I'm going to talk about axillary web syndrome, what it is, and how to manage it. Although not entirely a common side effect, it certainly can happen that after lymph node surgery, whether it's a sentinel lymph node or a full axillary dissection, that people can develop something in the armpit, the axilla, called axillary web syndrome. What this is characterized by is tightness in the armpit, and not just ordinary post-operative tightness, but actually something where you develop thickening of the tendons. It feels like your tendons are super tight. That's called cording. And there can be a single cord or multiple cords. This is not subtle. This isn't something that a doctor has to find, though of course having somebody on your medical team confirm that this is what's going on is important for you. It's important to know this is not a cancer recurrence. It's not actually related to the cancer at all, but rather to the cancer surgery. Now, it can cause problems because of the tightness and difficulty raising the arm, really in any direction. And if one is about to get radiation therapy, it can be particularly problematic. Why is that? Well, when we get radiation therapy, we're lying on our back and our arm is extended over our head. And if you can't stretch your arm all the way up, it can make it very difficult to start radiation therapy. So what'll usually happen is you'll get treated for the axillary web syndrome before you go to radiation therapy. And that sort of delay is not a huge problem. If you get chemotherapy before radiation therapy, there's a little more time in which to treat that. The way axillary web syndrome is treated is with stretching exercises that start off very gentle so it doesn't cause more pain. And we also use warm soaks and massage. Occasionally, people will be offered laser therapy. I've talked about a lot of different treatments: radiation, chemotherapy, surgery, whether or not the lymph nodes are dissected. If you want to learn more about your particular treatment plan, visit Yerbba.com. So in this video, I talked about axillary web syndrome, what it looks like, that your medical team should confirm you have this. It's not related to cancer, but rather to the surgery. And the reason this would be important to get treated right away is because of radiation therapy, the positioning that your arm requires. It's also important for your quality of life. I've covered a lot. If this video was helpful to you, click like and subscribe. And don't forget to visit Yerbba.com for your personalized report for treatment options available to you.